Hi, my name is Megan Nelson, and I am going to be reporting on a scoping review on the periodontal implications of prolonged fixed orthodontic retention, and my PI was Dr. Man Hung. For an introduction, a fixed lingual or permanent retainer is widely used to maintain orthodontic outcomes, especially after braces, yet their long-term periodontal effects remain uncertain. Our objective of the scoping review was to first map evidence on prolonged fixed retainer use and the periodontal outcomes. We wanted to assess how the term prolonged is used and how it's defined across different studies. We wanted to summarize outcomes, different measurement methods, and retainer designs. We aimed to identify gaps in long-term and image-based bone assessment. And finally, we wanted to inform retention counseling and future research priorities. For our methods, the scoping review was conducted using PRISMA guidelines, and studies assessing periodontal outcomes in post-orthodontic patients with fixed retainers were searched. Data on different retainer characteristics, duration of retainer use, periodontal outcomes, and complications were all synthesized and then narratively put into different tables. So moving on to our results, as you can see on the left is our article selection. So this was basically our PRISMA chart, and we extracted articles that included the data that was mentioned in the methods and excluded articles that were either unrelated, opinions or reviews, retracted, or duplicates. And after scanning all of our articles, we ended up with 27 to move on to the data extraction. So after extracting data, we discovered that out of the 27, the most articles had a study design of randomized controlled trials. The most common follow-up duration was either less than 12 months or up to 12 months. And the number of studies that defined the term prolonged out of all 27 was only 14 studies. So the most common periodontal outcomes assessed in each study were gingival inflammation index, probing depth, bleeding on probing, clinical attachment loss, calculus, gingival recession, retainer-related tooth movement, patient-reported outcomes, alveolar bone height, and imaging. So moving on to the conclusion, the definitions of prolonged retention and reporting of retainer characteristics varied widely and limited our comparability. Fixed retainers are effective, and the periodontal risk we found appears more related to plaque control and proper oral health maintenance than just the presence of the retainer itself. We believe that future studies should standardize exposure definitions, periodontal outcomes, follow-up duration, and imaging approaches to inform retention counseling. One of the main limitations of our study was that there is no qualitative pooling, so conclusions are limited to trends and limit statistical comparisons across studies. And another limitation we had was that we did not include articles that were not in English, so that may have limited our scope. And finally, we would like to acknowledge and thank Roseman University College of Dental Medicine. Thank you.